The House Subcommittee is hearing 3 separate abortion bills, all of which seek to intrude into a very difficult personal private medical decision that should remain between a woman, her doctor, or her family, and her faith. One of the core missions of the ACLU is to protect the reproductive rights of women. A woman should be able to decide whether and when to bear a family. If she decides to bear children, she should have the absolute best prenatal care available. If she decides not to go through with the pregnancy, she should have safe and legal access to good medical care. These bills all impede those rights and intrude upon the doctor-patient relationship, and they all presume that women simply don't know what's best for their own futures. Yes, the first bill, which is House Bill 839, attempts to ban abortions post-viability, but defines viability as starting at 20 weeks. Every pregnancy is different, and every woman should be able to decide with her doctor, based on her own medical history and the doctor's best medical judgment, whether and when to terminate the pregnancy. Viability varies from pregnancy to pregnancy and from woman to woman. This is a medical decision, not a legislative political decision. The second bill is House Bill 277, which attempts to impose onerous regulations on abortion care providers that are not imposed on any other form of health care provider. It is an attempt to regulate safe and lawful abortions out of existence and turn back the clock 4 decades before Roe versus Wade. The bill also adds a 24-hour waiting period as part of the informed consent that the woman must receive from the physician, which simply assumes that the woman can't make a sound, reasoned judgment on her own with her doctor as to whether or not she should wait 24 hours. That should be a decision left to the doctor and to his patient. The previous 2 bills have as an underlying message that the legislature of Florida doesn't trust women. However, the last bill, House Bill 1327, indicates that the legislature particularly doesn't trust women of color, African American women, Asian women, and Latina women, and requires physicians to question them about their motives for obtaining an abortion. Although the bill purports to ban abortions based on race and sex selection, there's absolutely no evidence that women are obtaining abortions for those reasons. There's not even a test, as far as we know, to determine the race of a fetus. This bill is simply an attempt to use race as a wedge to criminalize abortions, and it is related to the despicable billboards across the country that equate abortion to racial genocide.